maybe it's not that therapy is not for you, but that modality of therapy is not for you because not everyone wants to talk about things. Not everyone wants to relive trauma, and different people go to therapy for different things. And I think there's part of the stigma that we're trying to move past in the world is that you don't have to be going through something to go to therapy.
Welcome to Your Story Doesn't End Here, the mental health podcast of military and veterans who refuse to be silenced. I'm your host, Rachel, and my mission with this podcast is to be a voice for those who don't have a voice, bring awareness to mental health issues, provide value and solutions, and to change the culture when it comes to mental health within the DoD organizations.
Hey everyone, thank you so much for coming back for another episode. This is your host, Rachel, and I am doing a solo episode today to talk about therapy. And the reason I wanted to do this episode is because I've recently experienced a mini therapy session with Alan Kanerva. If you remember earlier this year, I did a podcast interview with him. If you have not checked it out, please go do. It is incredible. The work he does is incredible. And he's up in Canada, but there are so many relations to what he's been through and the work that he does that really apply across the globe, to be completely honest. But I think that there is so much light that he shed that can help us in the US that are dealing with trauma. Specifically, he does work in the field of trauma and really truly believes that trauma is an injury that can heal. And I'll let you go listen to that episode so you can form an opinion about what he does yourself. But before I get into my experience and talk all about that, the form of therapy that Alan does is called NLP, or neuro linguistic programming. And I've talked about it a couple of times on the show before, but I was really doing some pondering on types of therapy and therapy modalities, and in thinking about how many people I've talked to before, myself included, that have said therapy doesn't work for me. And, it's not for me. And I've tried it before and I've been to a number of therapists. And I think when we get past the layer of gaslighting that there already is in the military, and we think about the options that the military or even the VA provides. And I think the VA is giving more options now, but on the active duty side, we're very limited when it comes to modalities and even what TRICARE itself may cover for therapy. And I think there's a layer of knowledge where people don't realize that there are other modalities of therapy other than talk therapy. And that's where things can get a little dicey in the world of therapy and really helping people out. Because I think a lot of times we think about finding the right therapist as in finding that right individual that we're comfortable talking to. And the problem with that is, we can go through 20 therapists in one modality, and maybe that modality doesn't work for us. And that's where we find that, we come to this conclusion that therapy is not for me. But maybe it's not that therapy is not for you, but that modality of therapy is not for you because not everyone wants to talk about things. Not everyone wants to relive trauma, and different people go to therapy for different things. And I think there's part of the stigma that we're trying to move past in the world is that you don't have to be going through something to go to therapy. But then, then it creates kind of this awkwardness, right? Like I've been to therapists before where, you sit down and they're like, all right, so, what do you want to talk about? And I'm like, I don't know. Like sometimes I need that direction of what to talk about. And if I just met this person, I don't necessarily want to open up to them about my entire life right away because I don't even know that we're a good fit. So then we're just kind of like sitting there awkwardly going over stuff. In my experience, I mean, you guys have heard me talk about this before. My experience in the Navy with therapy was that I was given all these tools. And for me, in my brain, I couldn't make the connection of where a therapist giving me these basic tools was helpful, because I felt like if I really wanted tools, I can go on Google and I can find that. We live in this information age where if I am experiencing anxiety and all I'm looking for is a tool, then I could probably just hop on Google and find that tool. But I was looking for something a little more out of therapy that I didn't feel that I really got when I was active duty. And I've heard both sides of the spectrum. I've heard people that therapy's really saved them and helped them. And then other people where it hasn't. And And a lot of the times that does have to do with the individual therapist, but I really truly think that sometimes it has to do with the modality. And so I did a little bit of digging into different therapy modalities. And on Psychology Today, I was actually really surprised to find there is tons of different modalities. And so I'm going to go through a couple of these with you guys just to kind of spread some awareness of what the options are out there, because I'm learning myself about this too. And if it gets a little too long, I might have to do a second episode on this, but I'm just going to start from the top, and I'll post the link for anyone that wants to do further digging into this to see if maybe something really resonates, or maybe you want to do some digging in your area to find someone. But just kind of keep an open mind about these different therapy modalities. But the first one is called Accelerated Experiential Dynamic Psychotherapy. And it's a form of talk therapy. It aims to help people overcome trauma, loss, or other serious emotional challenges, drawing on attachment theory, body-focused approaches, and other related disciplines. AEDP posits that humans are wired for resilience and have an inborn ability to cope with emotional pain. However, many people who have undergone trauma are unable to access these skills that would allow them to navigate these emotional challenges. AEDP aims to help clients uncover and draw on these innate coping mechanisms to manage their trauma and move forward flourishing. So I think AEDP sounds like it's like the basic type of therapy that most people do, that talk therapy that really like helps you dig to the root of trauma. But yeah, I don't relate well to this because there are traumas in my life that I have buried, and my brain can't access those because I've buried them under walls and walls and walls of, protection. And yeah, so I think that's because it's probably just the fancy name for regular talk therapy. But the next one on the list is called acceptance and commitment therapy. It's called ACT. It's an action-oriented approach to psychotherapy that stems from traditional behavior therapy and cognitive behavioral therapy. Clients learn to stop avoiding, denying, and struggling with their inner emotions, and instead accept that these deeper feelings are appropriate responses to certain situations that should not prevent them from moving forward in their lives. So I'm just going to read the first sentence or two on these because there's a long list here. The next is called Adlerian therapy, and I might be pronouncing some of these wrong, but Adlerian therapy, also called individual psychology, is a short-term, goal-oriented, and positive psychodynamic therapy based on the theories of Alfred Adler, a one-time colleague of Sigmund Freud. Adler focused much of his research on feelings of inferiority versus superiority, discouragement, and a sense of belonging in the context of one's community and society at large. According to Adler, feelings of inferiority can result in neurotic behavior, but in the right setting can also be used as motivation to strive for greater success. So what's interesting to me is a couple of these that I've read so far seem like the basis of what a lot of coaches use these days is teaching you to use your brain and almost rewire it in a different way. So anyways, the next one's called applied behavior analysis. And I believe I've heard of this one before. It's a type of therapy frequently applied to children with autism and other developmental disorders that focuses on imparting skills in specific domains of functioning, such as social skills, communication, academic and learning skills, motor dexterity, hygiene and grooming, and more. It's tailored to individual needs. Let me kind of go around here because this list is pretty extensive. So I'm going to just click on a couple ones that really stand out to me that I've really never heard of before, or maybe some unique ones that might be different. And then if you guys want to explore this list on your own, by all means, feel free. I'm going to post the link. You can check it out. You can dive deep into a couple of these. This one is called bibliotherapy. It is a therapeutic approach employing books and other forms of literature, typically alongside more traditional therapy modalities to support a patient's mental health. And I've used books before as part of therapy. I think if you're a reader, something to think about or something to explore, maybe if you used to be a reader. Another thing that is on the creative side of things, there's art therapy on this list. And I've heard of art therapy before. And I think when we often think of going to see a therapist, we don't think of things like this. But something that kind of comes to mind for me right now is a lot of times on the podcast, I've had people that have taken therapy per se into their own hands, and they found something that really excites them or sets their soul on fire. And so some of these modalities maybe necessarily don't have to be through a professional, but maybe something you could explore on your own, like reading books and learning more about yourself, or starting art, or trying different hobby. But back to the list. Looks like coaching is on here, dance therapy is on here. EMDR, I've heard of before. And it's a really interesting modality that I know quite a few therapists will integrate into their form of therapy. But it is a psychotherapy technique designed to relieve the distress associated with disturbing memories. So the idea behind this is that the eye movement will somehow affect, like the different eye movements can somehow affect the way your brain processes things, if I understand this correctly. And I know people have done this before, people that have worked for and people that it hasn't worked for. But to quote the article directly, it says short for eye movement desensitization and reprocessing. It involves recalling a specific troublesome experience while following a side-to-side visual stimulus delivered by the therapist. The resulting lateral eye movements are thought to help reduce the emotional charge of the memory so that the experience can be safely discussed, digested, and stripped of the power to trigger anxiety and avoidance. And I'm going to read a little bit further into this article because this modality is really, really interesting to me. But it says, despite numerous studies showing that the technique works for some patients, it's been highly controversial since it was introduced in 1987. No universally accepted theory has been put forth to explain how lateral eye movements are integral to the treatment. Further, the evidence is not clear that EMDR is superior to classic forms of exposure therapy, in which patients recall traumatic memories in the safe environment created by the therapist. Repeated exposure to the aversive memory in the safe context diminishes fear and avoidance of the memory in any situation that might trigger it. So, talking about exposure therapy, since it brought it up, exposure therapy is something that is like very, very well known in the world of therapy. And I think that exposure therapy is what makes therapy scary or triggering to trauma patients in general. And because I mean, no one wants to relive a traumatic experience. And then I think that you have to talk about myself specifically. When I'm in one traumatic experience, it can trigger memories of other traumatic experiences, and it can be very, very heavy to deal with. And dealing with that over and over and over is very, very hard. And I'm not knocking exposure therapy. I've never tried it, because I've been scared to try it. Full disclosure, I'm terrified of it. But it's just kind of something to keep in mind. And that's why I'm digging into these other modalities, because I think that there are a number of people in the world who are probably similar to me that are terrified of reliving trauma and would rather live with the discomfort in their life of burying that trauma and knowing that it affects us on a subconscious level and it affects how we act on a day-to-day basis rather than just facing our demons, quote unquote, facing our demons and dealing with it. But let's see what else sticks out here. Hypnotherapy. I did an episode on hypnotherapy with Guinevere Martin. Make sure you go check that one out if you want to get a glimpse of that. This is interesting. It's called feminist therapy. It's an integrative approach to psychotherapy that focuses on the challenges that women face as a result of bias, stereotyping, oppression, discrimination, and other factors, and how those stressors can negatively affect their mental health. It's based on the belief that wellness is inextricably linked to an individual's social and cultural identities and the political environment in which they live. What else do we have? We got like play therapy on here. We got multicultural therapy, Jungian therapy, sometimes known as Jungian analysis, probably pronouncing this wrong, as an in-depth analytical form of talk therapy designed to bring together the conscious and unconscious parts of the mind to help a person feel balanced and whole. It calls for clients to look at the real self rather than the self they present to the outside world. So it seems like a number of these modalities are like various forms of like the same type. So like you have your main talk therapy, and then underneath that, it seems like it's like an umbrella of all these different forms of talk therapy. So something to keep in mind as well. And maybe when you're searching for a therapist, you ask them, hey, what modality of therapy do you use? And if they just say like talk therapy, now you have something where you can say, okay, but what form of talk therapy? Are you going to make me relive my trauma? Are you connecting the conscious with the unconscious? Are you employing modalities such as EMDR? And they might tell you like, hey, it just depends on what you're dealing with. But I feel like and I don't know this for sure, but I feel like a therapist should probably know what their modalities are because they're probably an expert in that area. And if they're not an expert in that area, maybe consider a different therapist if you feel like you need someone that is very, very well tailored to your needs. I mean, everyone's a little different. So music therapy, animal assisted therapy, motivational interviewing, counseling method that helps people resolve ambivalent, oh my gosh, feelings and insecurities to help find the internal motivation they need to change their behavior. Practical, empathetic, and a short-term process that takes into consideration how difficult it is to make life changes. There's Christian counseling. So another thing to consider is, does your religion or your beliefs play a major role in the therapy method or modality that you need? What else do we have? Prolonged exposure therapy, positive psychology, prolonged exposure. This is one of those exposure therapies that I talked about, but it is a form of psychotherapy for PTSD or post-traumatic stress disorder. After a traumatic event, some people experience unwanted thoughts, disturbing nightmares, feelings of hopelessness, depression, and hypervigilance. The article says if you have these symptoms, you understandably want to avoid those thoughts, feelings, and things that remind you of trauma. But the goal of prolonged exposure therapy is to gradually help you re-engage with life, especially the things you've been avoiding. So let's see. I'm going to do a couple more of these. Sand play therapy. It's a nonverbal therapeutic intervention that makes use of a sandbox, toy figures, and sometimes water to create scenes of miniature worlds that reflect a person's inner thoughts, struggles, and concerns. That sounds kind of fun. Huh. Interesting. I've never heard of that. Apparently, it was developed in the late 1950s by a psychologist, Dora Kaif, who combined several techniques and philosophies to come up with her own therapeutic approach. And it sounds like it might be more of like a pediatric form of therapy, but it actually sounds kind of fun. I don't know. Something to explore. I can imagine if you went to a therapist and you were like, yo, where's the sandbox at? They'd be like, excuse me. But, every different things work for different people. So, all right. So we got Gestalt therapy. It's an approach to psychotherapy that helps clients focus on the present to understand what's actually happening in their lives at this moment and how it makes them feel in this moment rather than what they assume might be happening. And we will do one more. Let's do neurofeedback. It is known as EEG. So it looks like it's, and I feel like I've connected with someone that uses this modality and I want to get them on the show. And I think this is it. I'm not sure. But it almost sounds like a modern form of I don't want to say electroshock therapy because it has such a negative connotation with it. But I'm going to read this directly off of Psychology Today, but it's known as EEG, electroencephalogram biofeedback. It's a therapeutic intervention that provides immediate feedback from a computer-based program that assesses a client's brainwave activity. The program uses auditory or visual signals to help patients recognize their thought patterns and try to modify them. Through this process, clients can learn to regulate and improve their brain function, hopefully alleviate symptoms of various neurological disorders and mental health conditions. I think what's cool about this one is it takes the brain and it takes our thoughts and it makes them something a little more tangible. So we're actually able to physically see. And this is if I'm understanding this correctly. But maybe for people that are a little more visual or want to see something that's going on instead of feeling like our thoughts are something that's just like this imaginary thing that isn't tangible because it's associated with our brain. Maybe something to explore, something to look into. But anyway, so the form of therapy that I really, really want to focus on though for this episode, now that we've gone through a couple and hopefully you have an understanding that there are multiple modalities, there are multiple types of therapy. This list has probably like 50 plus different types of therapy on it. And having an idea when you go to see a therapist of what works for you is so incredibly important in finding someone that's going to help you heal in a way that makes you comfortable and makes you feel like, this is something that works well for me. really quickly before I get into this, there's another form of therapy that I just wanted to hit on really quick. It's called somatic therapy. And it's a form of body-centered therapy that looks at the connection of mind and body, and it uses both psychotherapy and physical therapies for holistic healing. Um, Something that I looked into at one point, didn't move forward with it, but yeah, point of this, do some research, figure out what might resonate with you, and then maybe center your search for a therapist around that. And I think it'd be really cool, from my standpoint as a mental health advocate, to start pushing for different modalities to be covered under TRICARE. And I'm going to do some more research to see what TRICARE actually covers in different areas, and if it's only a talk therapy or if they do actually cover these different modalities. I know that in some instances, sometimes like an inpatient, they'll cover things such as EMDR, but I don't know about these other forms of therapy. So I'm really, really curious on that. I'm going to do some digging, and I will let you guys know once I do some more digging on that. But please find what works for you. Don't give up on therapy as a whole, or, exploring things that might work for you as a whole because the general psychology or psychiatry population says, oh, talk therapy, this is what's covered by TRICARE. And please, if you are in the position where you can afford to try something outside of what TRICARE might cover, go try it out. Because at the end of the day, we're very much limited sometimes by what our insurance covers. And TRICARE is free and all, and it's supposed to be good. And there are things that I'm incredibly grateful for that TRICARE did cover for me. But at the same time, I know people in my life that limit themselves on their healing journey because they're like, oh, well, my insurance covers this, so I'm just going to stick with this. Or they just don't even take the opportunity to pursue other options that might work for them because they're very much, I can't even use the word entrapped, but stuck in this bubble of like, this is what therapy covers. And so as I continue to connect with more people that maybe are offering options for active duty or veterans that can help them out, that's my ultimate goal. And my vision for Your Story Doesn't End Here isn't just to be a podcast, but is to have the ability to help sponsor people to be able to try different modalities of therapy that might help them so that they're not entrapped in a system that only covers something that maybe doesn't work for them. So that being said, now I'm going to get into my experience working with Alan and the neuro-linguistic programming therapy modality. And again, if you want to know more in depth about what Alan does, he has so much content on the internet. He has an Instagram page. He has a website. He has the episode I did with him, a phenomenal human being doing phenomenal work. He's worked with some incredible people in his time so far, and he's expanding his work to be able to help even more people. But neuro-linguistic programming, if you're not familiar, I'll read the definition off of Psychology Today. It is a set of principles and techniques aimed at enhancing self-awareness, increasing confidence, building communication skills, and motivating positive social actions. It was actually created in the 1970s by Richard Bandler and John Grinder. Became popular in the commercial and self-help realms, which is super true. You'll see, I get ads on my Facebook about NLP and getting certified in 7 days, and which is kind of scary because it's dealing with humans' emotions and their brain. And to have someone get certified in 7 days, I feel like is not enough. But Psychology Today does stress that there's no regulation of NLP, which, again, is clear in knowing that you can get certified in 7 days on the internet. I mean, there's so many people out there these days that are saying, oh, I'm NLP certified, but I've done NLP before, and I'm familiar with the method that's usually used. And what was interesting about my session with Alan is it was very different than what I had experienced before. So no, I had a 2-hour session with him. And when we started our session, it was just chit chatting, talking about life. It wasn't anything super formal, like, okay, well, I have an hour. So now tell me what you want to talk about. We just chatted about life. And to be fully transparent, and Alan was very transparent in my episode with him. It does not take long for NLP to work. He says that there's people whose trauma he has cleared in 15 minutes, which sounds very woo-woo to a lot of people, because when we think of some people who have years and years and years of trauma, to say like, hey, I can help you in 15 minutes, it sounds crazy, right? And do I say that I am fully trauma-free, healed? No, I'm not. But that's because in my life, I don't just have one trauma. 2 hours is enough time, and just an initial session for something to say like, hey, we're going to clear everything. But what Alan did is, he taught me, first of all, a breathing technique to help really get me centered and grounded and calm, and to regulate my nervous system. And I still use that technique of breathing. It was really, really cool. And you breathe in, you fill up your lungs to capacity, you take another breath, and then you breathe out. And so that was the first thing that he taught me, was that breathing technique. And then after that, we started to get into the therapy piece. And what's really, really cool, and what I love about NLP, is it doesn't actually force you to relive trauma. Now, my body will always have like a physical response to thinking back on certain parts of my life, like even certain years of my life. And to explain NLP, it's like you visualize yourself in your life as a timeline, and you're above that timeline, and you're kind of going back through that timeline in your head and visualizing certain parts of your life, and you're really relying on your subconscious to tell you what happened. And so in this process, I was able to identify several different years of my life that were traumatic, and if they affect me. And I felt like a physical response, like my chest tightening in certain areas of my life, but there were certain areas where I couldn't necessarily remember a specific event happening. And my body just knew that something happened in that time frame. And so what I like about NLP for people like me that can't necessarily remember specific events is that you don't have to do the whole exposure therapy thing where you're recalling an event exactly as it happened, because, I don't necessarily remember these events as they happened. My body just recognizes that something in this time period of my life happened and that it's affecting me. And so, I was able to number, what the top 3 events were based off of, that time period, age that I was, that were affecting me, and which one was affecting me the most. And what was very interesting to me is that I've always thought that the events that affected me the most were the ones that happened in my childhood years and my teenage years. But it turns out that the traumatic event that was affecting me the most in this time happened last year. And what Alan basically had me do was just like visualize, and I'm giving you guys like a very, very basic overview of this. So this isn't step by step exactly how it happened, but basically like I'm sitting in a movie theater and I'm playing a film of my life and connecting like a really, really good period before the event to a really, really good time period after the event. And in that, basically training my brain that, connecting like connecting good, I guess, with the event instead of trauma with the event. It's really hard for me to explain. And it probably sounds crazy in this episode. I really, really encourage, if you're interested in NLP, to just book a free session with Alan and do a consult. He offers that to my listeners. And so if you check out the show notes on the episode, you can definitely connect with him. And I encourage people to do that just to learn more about it. Because realistically, I'm not the expert here, but I just remember like this movie theater that he had me visualizing and thinking of like a good time prior to the event and then a good time after the event. And then I don't remember exactly what we did, to be completely honest with you, but what's weird is like there wasn't a time where I felt like, oh, I'm healed, I'm good now. But he had me visualize after, this movie theater visualization that we did, picturing into the future and like, hey, are we good here? Like, what are our feelings about this? And my first set of feelings was like, oh, I still feel this physical response to this event. Like I still feel a little bit of anxiety around it. So I was like, well, shoot, maybe it's not working. But then he had me, go a little further into the future. And it's like, okay, well, now what are your feelings about it? And I felt fine about it. And so, I didn't feel like right after that therapy session, I didn't feel like, oh, all my problems are solved. My life is good now. I'm healed. I will say that I felt more awake when I first started therapy with him. And I find that this is a natural response that my body has, is to be tired in response to like dealing with significant trauma, like even ahead of time. Like it was early in the morning. I think we had a 7 or a 7:30 session. I felt tired. And at the end of it, I felt more awake. And so that was the one thing that I noticed right off the bat. I will say that in like the couple days after is where I started to notice that like things that I wanted to do that were very difficult for me, that should have been easy tasks, were a little bit easier to do. So I started to notice these small, minute changes in my life. And one of the things that used to really, really hold me back during the day was like this sensation of not being able to move forward with things because of my anxiety. It would always stop me from doing the things that I wanted to do in my life. And I noticed in the last couple of months that I was kind of in this position again. It wasn't that crippling physical symptoms of anxiety that I was having, but I was in this place where like things weren't moving forward or progressing the way that I wanted them to. And so to notice these small, minute changes where things are starting to progress better than they had was huge for me. And that's where I really, really love this specific modality. Now, Alan doesn't only do NLP. If you do a full program with Alan and the trauma team, they use NLP as a modality as part of therapy. And so something you're going to have to talk to him about if you're interested in learning more about it. But I thought it was really cool that there's this ability to heal trauma without having to go into the trauma. And I probably did a horrible job explaining how my experience was. But I think if there's anything I want you to take away from it, it's that this is a form of trauma therapy that is not only scientifically proven and works for a lot of people, but it does not force you to relive trauma. And so I think it's a phenomenal modality on the contrast side of like an exposure therapy, especially for people dealing with PTSD or really anything trauma related, because the trauma that I've gone through in my life really does affect everything in my life. And again, like exposure therapy is just not something that I'm willing to do. So I hope you guys check out NLP, check out Alan. If there's anyone I would recommend for this, it would definitely be Alan over anyone else, just because of the position that he holds in the NLP community from a professional standpoint. He's not just, like a coach that got certified on the internet. So his program and working with him, it is very, very cost effective compared to a lot of other talk therapies that can take years and be a little harder on the bank account. And so when I talk about, having a vision of wanting to sponsor people in the future, this is one of the things, because it is effective. It's not drawn out and it works. So, which I guess, I'm repeating myself there, but anyway, so that was my experience. I had my session with him, I want to say 2 weeks ago now. And so reflecting after, the fact of the therapy session, but also the weeks preceding that therapy session. And I don't think enough people know about this. I notice a lot of people in my life that from the outside looking in, I can see they're really struggling. And I really feel that my job as a friend is just to check in and be there, and not to reach out and say like, hey, you need to do this, you need to try this. But I also feel that my job and this platform that I have is to spread awareness of what is available out there, because we don't know what we don't know. So, maybe we really, really love animals, and there's a form of animal therapy that's out there that we didn't know existed. And we've been trying talk therapy for years and we feel like it's not working. And we're really starting to give up on therapy and feeling like we have to live in this pain forever. But there's so many other modalities out there. Maybe animal therapy is the one thing that can help. So expand your mind when it comes to trying new things. And, try to find maybe a community of people who have tried the different modalities so you could ask them about their experience. Take advantage of consultations with therapists who can answer questions for you, find what works for you, and just try it out. And if it doesn't work, that's okay. Try the next thing. But I really encourage you to not give up just because one thing didn't work, or maybe you don't know what else is out there. So again, I'm going to post the list from Psychology Today into the show notes so that you can go through, check everything out yourself. And then hopefully I can get some therapists on the show that are experts in these different modalities so that we can learn a little bit more in depth about it and have some options for you guys to check out and look into. And hopefully that's helpful for you. So let me know. Reach out to me on Instagram. Send me an email at podcast@ysdeh.com. Let me know if you've tried any of these different modalities, or if you know someone that operates out of these different modalities that would be willing to be on the show, or just reach out in general. If you're struggling, my inbox is always open. I'm happy to just listen and be that non-judgmental ear. So appreciate you guys again listening in this week and listening to the things that I'm learning about, and hopefully you're learning about as well. And every single Monday, 5 a.m. EST episodes drop for Your Story Doesn't End Here. And I will see you guys next week.
Thank you for taking the time to listen in today. With your support, we are able to increase awareness of the mental health issues affecting service members and veterans today, with the goal of creating positive change. If you got value from this episode, please take 30 seconds to subscribe and share this episode within your own network. Until next time, remember, your story matters, your mental health matters, and your story doesn't end here.